Not all pain is coming from the loss of cartilage in the actual hip joint. It could be a bursa, it could be a nerve impingement, it could be tendonitis. But luckily, all those things can help be managed simply by getting stronger. Even if you do have actual discomfort from actual loss of cartilage in your hip joint, there are things that you can do to help manage some of the pain that it's creating, some of the things that your body's doing to stabilize the area that have nothing to do with the actual joint.
Nancy's one of my clients, and her story is the reason these exercises exist, because Nancy came to me with some hip degeneration heading toward a double hip replacement. But the scariest part wasn't just the diagnosis. Her leg was locking, completely frozen mid-step. Sometimes for 30 minutes at a time, her leg just wouldn't move. She had been told to keep moving gently, be careful, rest it. Well, she did all that, and the locking kept happening. The muscles around her hip had gone quiet. Her body had been protecting that hip for so long that the surrounding muscles had stopped doing their job. The nerve was being compressed. Maybe the bursa was under some pressure. The hip had no support structure left. That's a compensation problem. And some of that compensation could be corrected.
So there may be a strain in the muscles, there may be imbalance of muscle strength, there may be tightness in the muscles themselves. But a lot of these things you can manage with the right exercise and simply by getting stronger. I'm Coach Rudy. I've been doing this for over 35 years. First in physical therapy, I worked with a lot of people for a decade, getting them stronger, dealing with these types of issues. And now I'm working with people in midlife into their 70s, 80s, and beyond to make sure that we're doing things that can build strength, because it's not so much aging, it's a disuse. It's the move it or lose it era for you right now, okay? So I'm working with people who don't want to lose it. They want to make sure they're doing everything they can to keep it.
Early on, one of the first exercises we tried for Nancy was the chair hip extension. This is exactly where Nancy started, even when the locking was still happening. She was bracing herself with her hands, or if you want to try it and you have armrests, your elbows on the armrests, and simply lifting her hips. The muscles in the glutes, the low back, and the deep hip stabilizers are activating. If you have compression on a nerve or tightness in a bursa, this movement begins to take that pressure off, not by stretching, but by strengthening.
Think of it this way. The hip joint is like a neighborhood, okay? So there's adjacent buildings like the muscles, the tendons, the things that cushion the joint, the bursa, the things that activate the muscles around the hip, the nerves. So there's a lot of things in that neighborhood. Those are things that live outside of the hip joint, okay? So we have things that we can hopefully manage to prepare you for hip replacement if that's what you need, or to maybe help relieve actually a lot of the pain. But keep in mind that those things are outside the hip joint. What's happening in the hip joint is probably a whole different story.
Hands or elbows on the chair. Use the support. Just lift slowly. Breathe out as you lift. You should feel your glutes and the back of your hips engaging. If you feel any sharp pain, reduce the range. Even a small lift is progress. 3 sets, 8 to 12 reps. Just go at your own pace. Even if you do have actual discomfort from actual loss of cartilage in your hip joint, there are things you can do to help manage some of the pain that it's creating. Some of the things your body's doing to stabilize the area have nothing to do with the actual joint. There may be a strain in the muscles, there may be an imbalance of muscle strength, there may be tightness in the muscles themselves. But a lot of these things you can manage with the right exercise and simply by getting stronger.
And because we're having pain outside of the hip joint, we simply don't know what's really causing it. Now, there may be an actual issue in the hip joint, but there may just be overuse. I've got ladies in their 60s and their 70s playing tennis. Pickleball's become a big thing. So yeah, there may be actual issues with the actual cartilage in the hip joint, but there may also be issues with nerve impingement, the bursa, like I was saying, some just overuse of the muscles where you see it. This is the thing that I tell all of my active people. It's like you see athletes icing all the time. They're in their 20s, they're at their peak, and what they're doing is you see them interviewing, in the locker room, they have ice on their elbow, their shoulder, their hip, whatever. But when my clients go and they play and they're competitive, they play pickleball, they play tennis, they play basketball, they're out there playing golf. They never ice, they never do anything afterwards unless I'm really making sure that they're doing it, okay? Why do they not do things that actual professional athletes have to do themselves? Just keep that in mind. You have to make sure that you're doing things to recover, to deal with inflammation if you're going to be active. And that includes gardening or just heavier chores around the house or running around, the park and hiking up trails with your grandkids, all right? All those things are athletic events, all right? And just like a professional athlete that ices, just keep in mind that you should ice, you should do the things that you need to do, take a hot bath after you do those things that cause so much exertion and may exacerbate some of the issues in the pain in the hip or knees, shoulders, wherever it is that you might be having an issue.
Now, the second exercise is the overhead chair squat. Nancy's holding a resistance band overhead, and that detail is the whole point. When the arms are overhead, the spine has to stay extended, which means the hips have to do the actual work of getting up and down. We're building strength around the hip joint without causing any extra wear and tear on the joint itself.
It's not aging that's taking your ability. It's the disuse. It's that use it or lose it time. And the good thing is that can be reversed. You can get stronger. What's going on in the joint, the deterioration, the arthritis, osteoarthritis, that's part of the story. The other part is the weakness in the muscles, inflammation, bursitis, things like that, soft tissue stuff that can be treated. And that's where getting stronger helps to come into play.
Band overhead, keep arms in line with your ears. Sit back into the chair. Don't just fold forward now. Now drive through the whole foot as you stand. Put your weight in your heels. Keep the chest tall. Breathe in on the way down, out as you stand. This exercise is also taking pressure off the knee joints as well. And the shoulder and upper spine benefit too by building better posture. One movement working multiple systems at the same time. It's one of the best full body exercises for rehabilitation.
The joint pain is a symptom of something deeper that may have to be taken care of medically. But for us, the muscle is the story. And that story can be changed if it's heading you towards a lot more lack of use. We've got to use it or lose it right now, people.
The third exercise is the chair hip stretch. It comes after the first two exercises, not before. We build first, then we open the range. If your doctor or physical therapist has told you not to do hip stretches right now, make sure you listen to them. But for now, I'm just going to show you. Nancy's sitting on the edge of the chair, one foot forward and the other leg pulled back, sitting tall, hands behind her head and gently leaning back. You're going to feel this in the front of the hip. That's what we want. Opening up slowly with control after the muscles have already been warmed up from the first two exercises. You sit tall before you lean back. The lean is small. Hold for 5 seconds to start. Work around 10. If you feel real pain, come out of it. 3 to 5 holds each side. Nancy stayed at 5 seconds for several weeks. That's the body learning to trust the movement again.
One of the great things is my examples that I use to show these exercises, these are all clients. Basically, almost every one of them are in their 60s. Some might be in their 50s. Some might be in their 70s or 80s, okay? They're all sister lifters, all right? And the good thing is to keep in mind is a lot of them started exactly where you are right now, with recovering from osteoarthritis, joint replacement, back surgery, all those things. They're coming from the same place. These are not women that were athletic their entire lives. I do have some, that were athletes in college. They paid the price in certain ways. We'll go over those stories. But the thing is, take a look at the examples. These ladies started probably where you're at, and they've overcome so much, and you can too. Now, you're going to hear, that you're older, your coordination isn't as good as it used to be. People are worried about you falling. The thing to keep in mind that being careful without getting stronger isn't going to help you. Okay, that just makes your decline a little quieter because you're sitting on the couch not doing anything. You're watching the kids at the park sitting on the bench. All right, you're not in there playing with them. All right, that decline gets quiet and then it just starts to happen more and more. Okay, so being careful is fine. We all have to be careful. But being careful and not getting stronger is the thing that's going to prevent you from enjoying so much more that you can do. Again, it's to use it or lose it, all right? We have to find out a way to use it to get you stronger so that you can do all those things. You can be as active as possible. There's no reason that aging is stopping you. It's just that you've gotten weaker, and we can get you stronger.
These exercises connect to the work we've been doing all along, just like the lying hip raise you may have seen in a prior video. That one builds strength without putting any pressure on the hip joint at all. These are different angles, different ways to work the soft tissue around the hip to either relieve pressure or build strength. And this extends to the knees, the low back, the shoulders, the spine, whatever is holding you back. The approach is always the same. Find what you can do and then build from there.
So if it is your hips, if it is your knees or your shoulder or your low back, if something's bothering you, if it's holding you back and you do need some medical attention, well, obviously get that medical attention. But the thing is, you have to make sure that after that or before surgery that you have to get as strong as you can, okay? Because the thing is, you don't want that preventing you from doing all the things you want to do, okay? So strength always plays a factor. Listen, I'm going to tell you something right now. This is probably the most important thing I'm going to tell you today. You're not fragile, okay? You can get stronger. You just haven't been guided down the right path to get you strong. Regarding your injuries, the things that you've had to deal with, your busy schedule, and making sure you're doing the right strength training to give you a higher level of function and a higher level of health as we move into later life. Now I get, fitness, looking better. They usually go together. And yeah, no matter if you get in better shape, you're going to look better, all right? You're going to stand taller, you're going to have more energy, all right? And that's always going to be a facet. If you get stronger, you're going to look better, you're going to feel better, which is more important. And the thing is right now is looking better, I say, has to be just a benefit, because the main thing we want is to make sure that we keep our health, all right? We don't want to be struggling into midlife and then just accept that descent of health. If you haven't been doing any strength training, if you haven't been as active as you can be, like you've seen with a lot of my clients, that's going to happen. But you can also get in much better shape because you're getting stronger, okay? And that's the priority. Not so much the appearance. Sure, we all want to look better. I get that. But it's that high level of ability, at higher level of health that we should be focusing on. That's what my clients want. That's what I want for them. Now, I know your doctor, your family, they're like, start out slowly if you're going to try and get stronger. That's great. I say the same thing. If you haven't been doing anything and you're recovering from some type of joint pain or health issue, obviously we do start out gentle, okay? I'm not here to impress you with how much I could crush you or anything like that. That's crazy. But keep in mind, that's the starting point, all right? Gentle is great. But getting stronger eventually is the goal. That should always be the goal, all right? You don't have to lift 200 pounds off the ground like some of my clients do. It's just they get a lot out of that, but you have to get higher. You have to make sure that you're getting as strong as you can, all right? And that's what I teach, that's what I coach, that's what I feel everybody should do, especially after 50. Look, if you're still watching this, that means I think that your body really wants to have a plan, have a path, have a coach, have a bunch of coaches, have inspiration from the other sister lifters here in the community, all right? So if you watch this whole thing, here's what I have to offer you. Just go ahead and click the link in the description. That's gonna take you to the next step, okay? The plan, all right? We're gonna show you what's next, what you have to do. And again, that's just it. We're gonna show you what you have to do. You're not gonna have to figure it out yourself. I know this population. I'm part of this population, all right? I know what it is to just need simple guidance, to say, you know what, take me to the next step, you know? Don't give me the whole plan, don't overwhelm me, don't give me too much tech. I know the program that they're all following here, that you've seen these ladies doing, is easy to follow, and that's what I want for you too. So hopefully I will see you in the program. Go ahead and click the link in the description.